Hello and welcome to the How to Carnivore podcast. I'm your host, Simon Lewis, and you're tuning into the Plant-Free MD series with Dr. Anthony Chaffee. Dr. Chaffee is a surgeon, nutritional researcher, and former pro rugby player.
The root cause of a lot of these joint pains.
Yeah, so commonly we get pain in our joints because of arthritis and damage to the cartilage, which then wears down to the bone. The bone has a lot of nerve endings, and they can be quite painful. So once these start rubbing together, you're getting a lot of pain. The cartilage doesn't have any nerves to speak of, so you don't feel anything there. So it's when they wear through that you start to have a problem. But at the same time, your experience of pain is going to be worsened or lessened depending on what you eat and what you have in your body. If you have a lot of inflammation and things that you're eating or things that you're doing are building up different inflammatory factors in your body, they will sort of latch onto these areas of damage and they will exacerbate that pain. So if you have arthritis in your knees, which I have on my patellas, because of just years of kickboxing since I was a kid, doing knee strikes, it just damages the cartilage. I didn't know that at the time, but that's what happened. The rest of the knee is perfect. All of my other joints are perfect, but there's just that one area and it's worn away, and that causes a problem. When I was eating sort of a normal diet, that was fairly painful. Now it's not really painful at all, and it's actually worse because it's broken down more since then. You'll see different arthritis patients and arthritis sufferers who end up getting joint replacements or needing joint replacements. And then all of a sudden they switch their diet, they go on a carnivore diet or even a ketogenic diet, and they remove so much of this inflammation, and they are eating more healthful foods such as fatty meats, that they reduce their inflammation, they reduce their pain, and all of a sudden they don't need any surgeries anymore. Dr. Sean Baker, he found this out in his practice. He was keto at the time, and he was encouraging people to get on this diet, and they were all of a sudden didn't need joint replacements, didn't need shoulder replacements. Maybe they replaced one and they were planning to do the other, and then all of a sudden they said, actually, I don't need that. In true selfish fashion, the hospital group that he worked with got really upset at him because surgeries paid the bills. And so, he's bringing in office visits and he's actually curing people, like a doctor, and he's helping people avoid surgery, which really is what you're supposed to do. But that's not what brought in the money. So they actually had a big problem with him. In my own practice, neurosurgery, people having very bad back pain, which you really can't do much for except under particular circumstances for back pain. There's not really many spinal surgeries that help pain. Most of the time it's musculoskeletal. You get just weakening of the muscles, and you can't support these joints properly. You just get backaches and you get bad posture that exacerbates it. You get arthritis in the joints, and there's not really much you can do for that. We don't have good treatments for that yet from a surgical perspective. So people come horrible back pain, and we don't really have any surgical options for them, or they have bad back pain and they have bad shooting nerve pain called radiculopathy down one or both of their legs from pinched nerves. Well, doing surgery on that area can fix the pinched nerve, but it's going to make the back pain worse, because now we're destabilizing that. We're cutting through tissue. We're separating the muscles from the bone. We're removing bone, and you already had a sore back because it wasn't strong enough to support it and had a lot of inflammation, and now it's even worse because now it's damaged tissue. So you fix that one problem and you worsen another problem sometimes. But when you reduce the inflammation in these patients, quite often they don't even need surgery in the first place, and my back pain is worlds better. I had horrible back pain since I was about 15. Now I don't really have much to speak of. It's just a bit of an annoyance every now and then. But as long as I'm not eating anything stupid or nothing slips in when I'm eating, I mostly don't notice it. So there are a lot of different things that can cause that. But to give a specific example, or a particular example, how do we combat this? We take anti-inflammatories, right? So non-steroidal anti-inflammatories or steroidal anti-inflammatories like prednisone, prednisolone. Those work. And if you have, you get a cortisone injection in your shoulder, like you don't have pain anymore. It just calms all that down because it just stops the inflammation. The non-steroidal anti-inflammatories, these work on different factors that cause inflammation and cause an exacerbation of this sensation of pain. Well, a lot of those molecules that anti-inflammatories such as selective COX inhibitors such as Celebrex or even aspirin and ibuprofen, they work on the downstream finished products of omega-6 fatty acids and omega-6.
Wow.
Yeah, so omega-6s and omega-3s are nearly identical molecules. They just have just a subtle difference in the shape, and they go down different biochemical pathways and then become different molecules at the end. And you need these things. You need both of them, but you don't need as much omega-6s as we're getting in our diet. And the final product of that is what these anti-inflammatories work on. So it's just something to think about. You're taking anti-inflammatories to stuff these guys down, and when you're eating things with omega-6s, you're bolstering up that number. Yeah, and so when you have a healing area, you have this nidus of healing tissue or angry tissue. This is where these things seem to glom on for whatever reason. Well, you have an inflammatory process. I mean, your immune system is the inflammatory process is your immune system acting. And so when you have a healing process, your immune system is going in there to try to heal this. So it's causing inflammation. There's healthy inflammation. There's very healthy inflammation. We don't heal without inflammation. And so, but you can have pathological inflammation. You have too much and it's causing a problem. It can cause pain. And so these things come in, all these factors come in, and there's just, an abundance of them and the wrong types. And you feel a lot more pain. You experience more pain and more swelling and more stiffness. And so when we work out and we exercise, we get little muscle tears and breakdown of our muscle fibers, and then that's healing. And so we bring in these inflammatory factors to heal these muscles. And because we're bringing in too much or, too much of the wrong kind of inflammatory factor, it hurts. And so when you don't eat that stuff, you don't have that in your body in the first place. And so people find fibromyalgia is one. Fibromyalgia is it's basically a diagnosis of exclusion. You've exhausted all of the other possibilities that it could be, and the doctor just basically put his hands up going like, I have no idea why you're in pain, but I believe you're in pain, so we're going to call it fibromyalgia. That's basically what fibromyalgia is. We don't really know what it is. We don't really know what causes it. We don't really know why some people experience it and others don't.
And what is it?
It's just a pain syndrome. It's just you just hurt. You're just in chronic pain. And so these unfortunate people end up being on with chronic pain specialists. So they're just taking heavy medication sometimes for years. It's not a specific injury that they've had, like they were in an accident and they broke their back and they're just in horrible pain from that for the rest of their life. We don't know what caused this, but this person is clearly in a lot of pain. And so they call it fibromyalgia. And I'm sure there are people that have, different doctors that have theories as to what exactly is going on. But traditionally it's taught that this is a diagnosis of exclusion, that we don't know what it is, but something's happening and someone's in pain and we don't have any clear reason as to why they're in pain. However, I've been getting copious amounts of messages from people, saying that, they don't have joint pain, they don't have soreness. Obviously, they're autoimmune issues, which is an inappropriate pathological inflammatory response. That these just melt away; they just go away.
On carnivore,
I've yet to see any autoimmune disease that does not just melt away within, say 3 to 6 months on a pure carnivore diet, just pure meat and water, especially red meat and water. Yeah. So this is significantly altering the inflammatory processes in your body.
Dude, I saw a great post. You might have seen it as well. Michaela Peterson put up. I think she put it up yesterday. And it was like a short snippet of her talking to the camera. And she said the one thing that she hopes sort of, in her lifetime that she sees is that people with autoimmune issues and diseases like she had are initially treated with nutrition and diet, particularly children.
I've yet to see an autoimmune disease that does not respond extremely well to a meat and water only diet. Certainly Crohn's and ulcerative colitis, that's just, just undoubtable. Also rheumatoid arthritis, Hashimoto's, even Graves. And, I've yet to see one that doesn't work. And I, talk to people who say, well, I have this very, very rare, very unique autoimmune disease. Do you know anything about it? I'm like, well, I don't, I haven't seen anything with that, but this is how autoimmune issues tend to respond in general. And either way, you're going to help your health, dramatically in every other aspect. There are other things that cause problems or other things that cause disease. It's not just the food we eat, but that's a major burden of disease is from the food that we eat. And so, it's worth a try. You're going to get a lot healthier anyway. And, and it could very well be exactly what's going to address your autoimmune issues, like so many other autoimmune issues. And so I get people telling me this constantly, that, they're getting, biopsies of their colon after a few months, and they have no trace of Crohn's or ulcerative colitis. They have no trace of their disease left. The rheumatoid arthritis, they've come off all their medications. They don't have any flare-ups anymore. They've lost 80 to 100 pounds or more. Fibromyalgia patients, that's one that was very interesting, because I've had a number of people say that they've had fibromyalgia for 20 years, and all of a sudden they go on carnivore for 4 months and it's gone. Yeah, well, I mean, there's obviously a lot of things that can trigger migraines, and a lot of them are food related, drink, alcohol related. So what does that mean? That means that there are things in there, there are factors in there that are causing some sort of process to precipitate a migraine or some sort of pain response. Okay, so there are triggers that we know of, big clear ones. Avoid these things, but that doesn't mean that's all of them. And those are just the ones that we've strongly identified. But when you just go into a ketogenic diet, you're eliminating a lot of these things as well. Most of this stuff goes away. So what does that mean? You're eliminating out these little factors. Now you're eliminating out all carbohydrates, grains, seeds, sugars, alcohol, and you're getting even better. Okay, so there's a lot of things that can precipitate a migraine. So doing the diet from an elimination standpoint, just eliminating out more and more things that could potentially cause harm and get down to the root, which is just meat. You're going to have a better time, because you have definitely eliminated out anything that's going to precipitate a migraine from a food standpoint. Obviously, you have other things that trigger these problems, but from a food standpoint, now you've eliminated these things. Now maybe you try certain things back in. You go, oh no, can't do that. That gives me a big problem. If you want to add things back in, I don't care to do that. I don't get migraines. I didn't have very poor health before all this. I just like feeling my best. I just like always feeling my best and always being, performing at my best. And that's how I prefer to live. And so, eating different things, I've never really cared to add anything back in. There's nothing that I've liked the taste of better than my health and how I feel. So, but if people want to do that, they can, and just be mindful of that. If you're doing this from an elimination approach, like with autoimmune or with migraines or whatever you have, MS, that's another one that is significantly helped by a carnivore diet. Multiple sclerosis, which is a nasty disease. When you eliminate these things out, if you're eliminating these things out, and you're like, okay, now I feel good and I'm just on meat, like Kyla Peterson did. And then she just said, oh, well, this is stupid. I clearly I can eat salads. Salads are good for you. She ate one salad, you bang, had a big rheumatoid arthritis flare up. So now she knows she can't do that. And every time she tries something back in, she flares up. And so she's like, yeah, I can't do this, even if I want to, which just sounds like, maybe she does. And Jordan Peterson, probably does, but, they valued their health more than they value the visceral experience of eating these food. And I certainly am in that same camp. And I don't even have as big of a response to these things as they would. You can certainly have damage. You can mistreat your joints, and that can cause inappropriate wear and tear. Yeah, and eventually arthritis. or you can have injuries that damage the cartilage as well. You can do what I did, which is, Muay Thai kickboxing, and you're just doing knee strikes on hard objects. And that just sort of bangs these things, clatters them together when they're not supposed to do that. And you get these little micro cracks, and those micro cracks all of a sudden are a point of friction now. And they just sort of wear and wear and wear and wear, and they wear out. However, we didn't really see those skeletons prior to the agricultural revolution. Any full-grown adult, they had, big jaws, straight teeth, no cavities, very healthy bones, on average 6'4" for adult males. And they didn't really have arthritis. We could tell. I mean, sometimes it's not a good enough specimen to be able to tell, but by and large, we could tell this. So